every wrong. You are always and forever God. Everybody say, your love is higher than the mountain tops. Your strength, a river that will never stop. Your mercy is endless and covers every wrong. You are always and forever God. Hey, if it wasn't for your love for us, we'd be drifting on the ocean lost. Your love has pulled us from the miry clay, the rock of ages who will never change. Everlasting, upendo wa milele. Everlasting, Baba, neema ya milele. Everlasting, Yesu, neema ya milele. Everlasting, milele na milele. Let's go. Your name has power over everything. Your word, a fountain of everlasting peace. Your voice is thunder to the enemy. You are always and forever God. Hey, yeah. If it wasn't for your love for us, we'd be drifting on the ocean lost. Your love has pulled us from the miry clay, the rock of ages who will never change. Everlasting, upendo wa milele. Everlasting, Baba, neema ya milele. Everlasting, Yesu, neema ya milele. Everlasting, milele na milele. Oh, no one, nothing compares to you, God. Your love endures for all of time. Everlasting, Bwana, upendo wa milele. Everlasting, Baba, neema ya milele. Everlasting, Yesu, neema ya milele. Everlasting, milele na milele. Everlasting, upendo wa milele. Everlasting, Baba, neema ya milele. Everlasting, Yesu, neema ya milele. Everlasting, milele na milele. Let's go. Oh, mama, mama. Yeah. Yeah.
Thank you so much for watching that video. Hey, don't forget to subscribe to all my online content platforms. But for those of you who want to go a little bit deeper, I have a special thing. I have an online community that's a worshiping community where you get exclusive content that comes directly to you. And if you want to join my online worshiping community, all you need to do is click on the Thank you so much for watching that video. Hey, don't forget to subscribe to all my online content platforms. For those of you who want to go a little bit deeper, I have a special thing. I have an online community. Nilikuwa
Good evening, everybody. Great to see you this evening. Thank you so much for being on time. Oh my goodness, there's so many people here already. It's so good to see you. Kev the Rev, I can see you. It's so good to see you. And hey, welcome, guys. Hey, you notice there's a poll going on, and it's just like a how much do you know poll. It's a family poll. So those of you who are on Zoom, you actually can do 4 questions. And then what we'll do, they're simple questions, and the only condition is you can't Google. Don't pull out a textbook. Just write what you think you know, and let's just see what you know and how true it is. And I suspect we're all going to be learning. That's what this is about. We just want to learn together. So it's really good to see you all, and welcome to our very first family night. Woohoo! We're so glad to have you guys here, and family night is just something we are excited to have we want to be doing it every Wednesday in this season. And the idea is, as we said earlier, to help our community to care for themselves and for their families. So how do you care for yourself, and how do you care for your family in this crazy season? Because we want a healthy community, healthy physically, healthy emotionally, healthy spiritually, healthy in every way. And there's a lot of information out there that has left many people confused. And yeah, we want to say, how do you understand things from a faith perspective? Everybody's giving you their perspective, but how are we as God's people are supposed to understand the world in which we live in? In fact, it's so interesting. Right now, we're doing a series at Mavuno called Let My People Think. Let my people go and think. Because we're saying we must love God, not just with our hearts, with our strength, with our souls, but we must also love God with our minds as well. So how do we learn to think right about our situation so we can do right in this situation? So the idea of the family nights is not to tell you what to think, but it's really just to give you information, to bring the right people around, to have the right conversations, so that as God's people, we can actually make the right opinions about the issues around us. And then as a family, that we can grow together in this season as well. And so, karibuni sana, I think we're making your history makers as you're here, because we're really making history. This is the first of its kind. And I just can't wait to see what God does with this event. It's great to see the different campus pastors from the different Mavuno campuses here. And I'm going to be asking them soon to just say something so you know that they're there. But one of the things that I want to just mention as we start is that, and this for me is very exciting, is that we've actually begun a conversation, or we've actually begun to do what we call our Sunday Zoom communities. And what is that? I mean, basically what we're saying is on Sundays, as opposed to just watching, one of the things we'd say to as pastors is, when we could see the looming lockdown, especially in Kenya. And as pastors, we said, look, if the churches are locked down this time around, we want to do it very differently from what we did last time. And one of the things we said is we need, I mean, yes, watching church on Zoom is one thing, but what if we could just experience, watching it online is one thing, but what if you could actually experience church, not just watch church, but be church in the process? And how could we keep our communities alive and vibrant? So we began, I think a couple of weeks ago, 3-4 weeks ago, we began what we're calling our Zoom churches. And every Mavuno campus that can is actually gathering people, its congregation on Zoom. So yes, they're watching the same service as people are watching online, but then there's an incredible, vibrant community going on, just like we have tonight, where people are actually conversing and talking as the message is going on, as the service is going on, and really worshiping together. So Kev the Rev, Pastor Kevin is here from Mavuno Downtown. And I just thought I'd ask you very quickly to tell us a little about what Zoom Church is looking like at Mavuno Downtown.
All right. Thank you guys for coming all. Let us pray as we start. Heavenly Father, I want to thank you. Thank you for giving us capacity to leverage technology across geographical zone and time zones and spaces, and to be able to gather as a family. What an amazing fact that you've given us not just biological family, but spiritual families for us to belong to. And so as we gather today as members of the Mavuno family, but also I believe other people from other churches who we are part of the kingdom together, I want to pray that you'll be with us and bless us as we have conversations, Lord. And each of us pick up something that you cannot just, that will not just be for this family, but for biological you. And just allow us to feel the joy of one another's warmth and presence as we engage tonight. Amen.
Amen. Awesome. And Pastor Kev, thank you for that prayer. Whether you're watching on Facebook, whether you're watching on YouTube, whether you're together in this Zoom conversation, our prayer is you'll just feel warm. I mean, this is family night. And family night is meant to be a time when the family gathers together and we just enjoy each other. So karibuni sana. Pastor Kev,
Yes,
tell
sir.
us a bit about downtown and yeah, what's it been like to have the family Zoom service? You had everybody, the people in downtown were in this campus service, Zoom campus service, as opposed to YouTube. What was the difference when you did that?
Yeah, first of all, just a shout out to all downtownians that I'm seeing here. Whoop, whoop, welcome, guys. I think it was totally amazing. YouTube as a space or Facebook as a space does not allow for the second parties to interact directly with one another. But this time when we use Zoom, there was that capacity for different people to interact with one another. For the pastoral team, each one of them to be able to interact with everyone else who joined the space directly with one another. And so that capacity to engage and interact is totally made the difference. That capacity for us not just to watch, but to literally engage made the difference. I mean, we had, our chat was quite active with people asking for prayer, or with people, reaching out directly to a pastor, because we had said that that's an option. You can reach out to a pastor directly. If you're a lady and you want to speak to a lady pastor directly, that option was available. And so people are able to connect directly with one-on-one with pastors. And that is not quite available on YouTube or other platforms. Yeah.
Awesome. And I mean, it was interesting. I have to tell you, I talked to somebody from downtown and they were like, man, we had such a fun church. They were like, this was real church. It actually was like, it felt like real church for her. I mean, and I guess she was comparing it with what it was like watching church on YouTube. And she's like, this was church for me. Like, what would you tell somebody who's in this call right now, who like why they must join their campuses, their churches, Zoom community?
Yeah, you see, number one, you see when you attend, let's say, church on YouTube, and it's great. I'm not saying it's a good alternative in the absence of one, but YouTube allows you to only consume. When you attend Zoom, there is capacity for you to give, because one of the things we are doing is that we are sending people to different prayer rooms to pray for one another. And the beauty about that is that you don't only get prayed for, but you actually get to pray for someone else. There's something that you're able to give that even I believe physical church doesn't always give us that capacity. Yeah. But this time there is capacity for you to come, not just as a consumer, but as a contributor, to be a net giver and not just a net consumer. And so someone is here and you're wondering, okay, what's the difference? Someone is the same, the people are the same, we still interact on the chat on YouTube. But this time you have capacity to actually come there to bless. One of the things I always tell people is come ready to say, who do I pray for today? You could be on the Zoom chat, see someone and be like, I really feel like praying for this person that I'm seeing here. And you can actually get in touch with them directly, pray for them. And that capacity for you to be prayed for is also available. And so it's not one, no, it's something you get to give, you get to receive, you get to come ready to be a blessing to people who are far away. And then the capacity for you to take it offline also becomes a real possibility, because if I come here and let's say I see Pastor Mugambi, if this was church, we get to talk, we can actually get it, we can go offline after that and we can continue with the conversation. There's real opportunity for care, there's real opportunity for you to be known, for you to be cared for you to give the same as much as you are receiving. So for me, I just say in this season when physical gatherings are not a possibility, then that becomes a real option. But go there, not just to say, okay, what do these people at downtown have for me today? Go there saying, who can I bless today? Who can I interact with today? And look at the chats. People always, on Friday, we had the same, people are talking there and people are giving numbers, asking for prayer. That's not just for the pastor to pray for them. That's even for you to say, hey, I saw your number and I feel this urge to call you and pray for you and to be a blessing to you practically. And I think that option is available for us through this platform.
That's, it almost feels like the church in the book of Acts, just some very exciting, everybody engaged. It's not just the pastor from the front, but it's like everybody's playing a part. And so so somebody is here, they want to join a community, maybe they're part of downtown, they've never even known you're doing Zoom church. Is there an easy way they can connect with that Zoom link for Sunday?
Yes, so what we are doing is that we are making it easy, and maybe I can give a plug here for the rest of the campuses as well. We are making it quite easy for anyone to join a campus Zoom service. So what we have is that our Zoom link is up there. It's www.bit.ly/downtown worships. and a.m. And that's the beauty. It's all at 10 a.m. So you can literally be in any one of our campuses. You can use that link you can search for that link and you'll be able to join in any one of our campuses. I can see there Karen worships. I can see there Wayakiwe worship.
Love it.
Yeah, so the idea is that if you know the campus, if you know your campus name, it will be much easier for you to just join in with the link. So my request is actually for all the campus pastors to just make it easy for us to simplify all our links. I know Life with Worships or Wayaki with Worships, then it becomes much easier for people to just join in having known your campus name. So that's it, sir. Yeah.
I love it. Well, thank you very much, Pastor Kev the Rev. It's great to hear from you. And for the rest of I guess the campus pastors, they're posting the links there. So, hey, if you're not part of a Mavuno church, you'd like to be part of it. And you know what? I'm going to ask Wangeshi, who's on this call, if you could actually copy those and put them on YouTube and on Facebook as well. Just so that anybody who's watching and just wants to be able to say, hey, what's the link for the campus closest to me? And you know what? Pick a campus. If you've never been to any of them, just pick one of them, join on Sunday, see what happens. Because I guess one of the things that we're saying, we want this to be about health, caring for one another. And one of the things that we're saying in this season, it's so easy to get isolated and so easy to just get into a spiral of people who are negative around you. And that just affects mental health, emotional health, spiritual health. And so this is just a good way, even a safe way to try out community, because then you try it out and you're like, wow, if I don't like it, I won't come back again. But you know what? You might make some connections there that are just really good life-giving connections. So thank you so much, Kev the Rev. It's great to have you. And yeah, why watch when you can attend? I like that. That's a nice slogan for Zoom Church. So hey, tonight we're going to be, one last thing I'll just also mention is we have what we call our WhatsApp community, and George is going to put a link for the WhatsApp community. And if you'd like to be notified about Mavuno-wide events, because sometimes you know what's happening in your campus, but you don't know what's happening, like an event like tonight, some of you may not have heard about it. If you'd like to be part of that community, then join the Mavuno WhatsApp community. And I'm going to ask George to put that on the link as well, on the chat as well, but also maybe put a poster up so that you can see where to click and be able to join that. So without further ado, today we want to talk about, well, 2 days ago, actually, we started Monday, we talked about to vaccinate or not. I don't know how many of you were there, but my goodness, we've had such incredible feedback from people, guys who are like, finally, I get it. Finally, I've got some wisdom, some light on this. It helps some people make some decisions that they were thinking about. Some of you aren't happy with it. And by the way, let me just say this. We're not trying to give you the answer. You know what I'm saying? We're not trying to tell you this is what you must do, that you must go and get vaccinated. So I love doctors who are sharing, they say, look, we're not saying you must get a vaccine, but an important thing for you to do. And so I'm glad that you were able to participate. If you didn't participate, go on the Mavuno Church.org Facebook page, and you'll be able to actually get the link for that. It was a fantastic, incredible conversation. But today we want to jump into another conversation. We're continuing this conversation. And today we really want to talk about this whole thing about how do we prevent and treat COVID-19? One of the things you want to know is when you get COVID, for the people who've had it, and we've had it in our family, it's a very scary thing. And so I believe today's conversation is going to be life-giving for us as we just get some tools, some skills, some help, so that when it happens to somebody you have the wisdom, you have the information, and information is power in seasons like this. So I'm going to invite Dr. Wahome Ngari. If you just put on your video, Dr. Wahome, it's great to see you today, and karibu sana. Yeah, it's thank you so much for making the time to be here. We are excited as a community that you'd actually, doctors are busy people. And in this season, they're doubly busy. And so we understand, and we just are grateful that as a man of faith yourself, you would actually make time for a faith community to help us learn how to think about what's going on. Now, maybe just tell us a bit about yourself. Maybe just do a little intro so we get to know you and what you practice.
Okay, thank you very much. I'm happy to be here, and thank you for the opportunity. I'm happy that Mavuno Church wants to listen to both sides of the story. That's the only way you can be sure you're making the right choices. My name is Wahome Ngari. I am a medical doctor. I specialize as an obstetrician gynecologist, which means I've dedicated my whole life to looking after the woman. Pole guys, no offense meant. um, I, um, I am a member of the Kenya Christian Professional Forum, and there I am the convener of the Life Committee. So it is my business to protect life from conception until natural death. And COVID, like anything else, falls in my docket in that ministry. Then I am a member of the Kenya Catholic Doctors Association, and have a slightly different view from the other colleagues about COVID and what we can do about it. And we did give a statement about it. And I suppose that would be part of the interests.
Absolutely.
Oh, sorry. This is family night. I am married. I have 3 kids. My oldest son is 28, and the little one is 16. And we are grateful to God for the experiences.
Thank you, Dr. Ngare. And it's just an honor to meet you. You made a video, as you said, you started speaking about this pretty boldly. Made a video that went viral actually, and sparked a lot of conversations. And it was interesting after I watched the video, and I actually shared it with a couple of people just to understand what's going, to know that we actually grew up in the same neighborhood, and that our parents were actually friends. And so it was just, it's a small world, as they say. So to have, as you say, just a wide perspective. We want to be able to increase our perspective so we know what's going on. Now, let me just ask this question as you introduced yourself. You mentioned you're a gynecologist, obstetrician, not a respiratory disease expert. And so some people would ask right off the bat, why would a gynecologist be involved in talking about treating COVID? I thought this would be something that would be reserved for the experts.
Yes, that's a good question. The first thing is that there is no expert for COVID-19. The disease has been with us for a very short time. In this country, basically from around February, March last year. So we are now doing 1 year. And in medical training, that's not enough for you to be an expert in anything. Now, it is also evolving very rapidly. It is also important to remember that before I became a gynecologist, I was a doctor. You must train first to be a general doctor before you specialize. And I am expected to take care of all sorts of illnesses in cases of an emergency. The other thing that is interesting is that in our profession, the children refused the lockdown. So colleagues were told to go home, close your clinics, do this. We are dealing with pregnant women, and babies don't care whether you have COVID or you don't. And therefore, I never closed my clinic. So through the whole thing, I've been working throughout, and I've had to look after pregnant women who have contracted this disease. Then their family and friends who call you because they have a crisis. They don't care you're a specialist. They know you're a doctor and they need help, and you have to engage. So in a time like this, you read as much as you can, listen out to colleagues, go into the net, see what people are doing internationally. Others who the disease went to before us, just how did they cope? What did they do things? How did they do things differently? Understand the basics, science, and then apply yourself. So in COVID, everybody is a doctor and everybody has to engage. We have no time for specialists.
Wow.
Now, that is as far as outpatient care is concerned. Now,
Yes.
once you're admitted to hospital, then it becomes a different ballgame, because then you have specialized units. Not everybody can go in there. And therefore, once somebody is admitted, then you kind of hand over to the team that is dealing with the inpatients. So even in our discussion here, we'll focus more on outpatient care.
Okay, well, thank you for that. It's great to hear that. And also just tonight's topic is preventing and treating COVID-19. And yes. So I'm going to ask you, by the way, for those who are watching both on YouTube, Facebook, Zoom, please use the chat. And if you have questions for the doctor on what he's sharing, especially as he said, on treating, on looking after people who preventing and treating COVID-19, please put any of those questions out, and we'll try. Hopefully, we'll have time to be able to answer some of them. But Doc, if I'll just kick us off by just saying, you know, the WHO protocols, at least in my limited view, I mean, I'm not a doctor, so, but in my view, what I've understood is when basically what they say is when I catch COVID or when I'm positive, the doctor is meant to treat my symptoms. For instance, if I have a headache, they'll give me paracetamol. If I have a cough, they'll give me cough syrup, and then send me home and keep an eye on it. And the time they'll really get engaged is if I start affecting my breathing. So, and the only reason I'm saying this is as a pastor, of course, I get people, I've had many people I've talked to who they went to see the doctor, they had all these things, but then they were just given the basics and to go home. And basically, it's almost like they were waiting for things to get really bad before they start to engage. Now, you can, first of all, I'd just ask if you could confirm if that's the case, if that's the way it's supposed to be, or rather, that's the way doctors are operating, and then share with us your view of how we should look after ourselves. So maybe what I'll do is just give you a few minutes to share some slides, share some thoughts on what is the way that we should prevent and treat COVID-19 from your perspective.
Okay, thank you very much. Now, like we say, information is power, and let me guide the people through a few slides, some basic information that is critical for all of us to know. So I'll share my screen. Let me know if you can see it.
Yes.
Okay, so that's our topic. Now, the first thing I'd like us to go through very quickly is the issue of why we manage pandemics. Why do we manage an epidemic? So epidemic is an outbreak that is located in one. When we use the term pandemic, then basically we are saying it's across borders, it's gone international. Now, when you do not intervene in a disease during an outbreak, what happens is that you have this exponential growth in the number of cases, very many people getting infected at the same time. Then eventually you reach a peak. As people start developing immunity and herd immunity starts setting in, then you reach a peak and rapidly decline, and then within a certain period of time, the disease is over. Now, the greatest problem about allowing the natural flow of it, our hospital capacity. So if we just have a certain number of beds in hospitals, and anybody who is above this line, so the whole of this group of people who got very sick but could not be admitted to hospital, we would lose this group of people, not because we don't know what to do, but because there are too many people and we have no space for them in hospital. Yeah. So one of the things that you want to do is you put containment measures, and the idea is to flatten the curve. So this is the idea of flattening the curve. Slow down the infections, and if you slow down the infections, then hopefully when you reach your peak, you still have hospital capacity, and then slowly the disease would die down. It would take a little longer for it to end than if you had let it go wild, but then you save lives. So this is really the issue about flattening the curve. Now, why does the curve flatten? It flattens whether you intervene or you don't, even if you didn't have any medication for this disease, simply because people develop herd immunity. So your body has what we call innate immunity. Even if you've never experienced a certain virus before, there is a mechanism within the body that is able to fight it back, and eventually people will develop some form of immunity that ends up being protective. Now, again, it's important for us to look at what is called the second wave, the third wave, all these things people are being threatened with. Now, if you start your containment measures, then you find your curve starts flattening. And what you do is you would relax some of those measures. And what happens is that you get another spike of infections because you have allowed more people to go into circulation. And then slowly that curve starts flattening. And then you relax some more containment measures and you get another spike. And that is how you get the waves. So the waves are really the modified flattened curve. And our last wave was coming basically from the fact that children went back to school. The children are getting very mild infections. And they were able to then deliver this virus to everybody who had managed to stay at home. And that is how we got this third spike. And it was expected. In fact, Kemri had talked about it sometime last year. Now, when it comes to managing outbreaks, when it comes to managing disease outbreaks, then there are certain things that you need to put in place. And one of them is the disease intelligence. So how many cases are you getting? Are they increasing? Are they decreasing? It is called case management. And this is where we treat the patients who are sick. You look for treatments, look around, see what it is that can be used until you discover what it is that can be the severity of their disease. And then, of course, the labs and the others. Now, what you would notice is that in the management of the COVID crisis, there is no case management. All this time, we have been told there is no treatment for outpatient care. And until somebody develops difficulty in breathing and they need admission to hospital, that's the time treatment is initiated. Now, this is another, one of the most important things I'd like you to keep in mind is that vaccination has never been part of taking care of an outbreak of the disease. So when you have the active disease going on, vaccination has never been an option. This is another paper that talks about the same thing. And again, I want you to note that case management is a very important pillar. It also goes to show, to record down here that lockdowns and closing borders are desirable only at the beginning of the crisis because they don't generally stop they give you time to put in measures so that you're able to deal with the crisis. Now, vaccination again is not part of this outbreak response. Again, it's important we look at the COVID tests and what it means to me as a medical worker, especially in the outpatient center. Remember that it doesn't detect the virus. What the PCR test picks up is genetic material of the virus. So it doesn't tell us whether the virus is alive and active in you or whether we are detecting the genetic material of a dead virus. Okay, so that is one of the things. The other thing is that up to 30% of those tests are false negatives. So you have all the symptoms of COVID, you do a test, and it is negative. The other thing is that we also have what is called false positives. And false positives are interesting because they depend on what we call PCR cycles. So if I run the PCR, say 25,000 times or whatever number of times, then the sensitivity is at a certain level. If I increase those cycles to say 40,000, then it picks up even more cases. So this can be a political tool. You can actually increase or reduce your positivity rate depending on how many cycles. So if you don't standardize the cycles, then people can play games with this. Now, the other thing is that you have had COVID, you have healed, you've gone back for a test after 14 days, maybe after 21 days, and the test is still positive. And this is because, again, we are detecting genetic material. You already have healed, but there is still some genetic material in your phlegm and stuff, and it will still pick it up. So a positive test after you have gone through the infection or treatment means very little to us as practitioners. Then it costs between 5 to 10,000, depending on where you go. And we'll see why this is important when it comes to the cost of treatment. And therefore, for me as a clinician, the PCR test is of very little value, is of very little value. If you come and you have symptoms and it says you're negative for COVID, it means very little to me. If you come and you have no symptoms and you have a positive test, it means very little to me. So it is more of a research tool, and you should do a test if you have the opportunity to do it because we need data. But from the perspective of a clinician, one who is treating the patient, you will understand why it is of very little value. Now, the other thing you mentioned is why are we concerned about the WHO instructions that we have received? Now, one of the things that is very strange to me and I've never recovered is the fact that we are announcing infections and death rates every day to the public. This creates a feeling of hopelessness. It creates an unusual fear in the community. And it is a very, very bad way of managing any stressful condition. It is making people sick just from thinking about those numbers. I have never seen this done before. This is the first time I'm seeing this being done. Then you remember we had media engineered fear. We got pictures of people dropping dead in China, hospitals that were full in Italy, crematoriums that could not cope in South America. You know, a lot of very frightening stuff being sent around, coming from BBC, coming from CNN, you know, spreading again a fear and a feeling of hopelessness. But the most interesting has been from WHO. They first told us not to do any postmortems. So bury the dead within 48 hours, 24 to 48 hours, don't do any postmortems. Now, it is important for you to understand that the only way we learn when we have a new disease that is killing people, the only way we can help the living is by studying the dead, looking at them and finding out what killed these people. And once we know what killed them, then we are able to come up with treatment protocols. So this was a very, very unusual instruction that is not good at all for any of us. And until an Italian pathologist broke this rule and actually went ahead and did a postmortem, he was able to describe to the world of medicine that people were dying because of blood clots in the chest that were being caused by the inflammatory process that was occurring in the chest. And just by introducing blood thinners in the treatment of patients who are admitted in hospitals, we were able to save a lot of lives that would have otherwise been lost if we had agreed to this instruction. The other one is the one you said, don't treat. There is no treatment for the virus itself, so give symptomatic treatment. Give Panadol, tell the person to go home, come back after developing difficulty in breathing. That's the time they need oxygen support, and that's the time you admit them. Again, I'll show you why this instruction is very destructive. In fact, number 1 and number 3 are basically a death sentence. If I were to obey these two, then I would be actually causing death to my patients. Initially, they had said we couldn't use steroids. It's a type of treatment that reduces inflammation. They said you couldn't use it. Later, they revised this after doctors pushed back. It is a life-saving drug. These steroids, together with the blood thinners, are what are the game changers when you're admitted to hospital. And then the other thing that I mentioned lastly is that WHO is supporting the use of vaccines during an outbreak. Now, all these things go against everything I was trained as a doctor. Now, what determines how sick you will get, and what determines who I should treat? Now, the amount of infecting organism that you get at the point of infection is one of the things that determines how sick you're going to be. So the person who receives a very high dose at the point of infection and the person who receives a very low dose then will will behave differently. If you get a very high dose of infective material, you get very sick. If you get a very low dose, you may just get enough to develop immunity and actually not get sick. Now, the other thing that determines how sick you get is how good your immune system is. So the little children who are young with a virgin immune system, they have very good innate immunity. They develop their immunity very quickly, even to new infections, and they do very well. And that would explain why they're not as hard hit as the adults who have a more specialized immune system because of the multiple infections they've received in the past. Then the other one is how severe, how of the agent to cause disease. Now, if you have a very high buildup of the viral load, then you generate a lot of bacteria, a virus, then of course you get very severe disease. So if you have a large dose or your immune system is compromised and therefore the virus is multiplying more rapidly than it should, then you get very severe disease. But for me as a doctor, all that matters to me, I cannot look at your face and know how much virus you received at the point of infection. I cannot look at your face and be able to tell how robust your immune system is. So as far as I'm concerned, what really matters is, have you developed symptoms of the disease? So long as you have developed symptoms of COVID, then I must put you on treatment. If you have symptoms of disease and a negative COVID test, I must put you on treatment because there could be a false negative. If you went to do a COVID test because you were due to travel, but you ended up not, you ended up with a positive test, but you're not feeling unwell, you're completely well, then I will not put you on treatment. You don't need to be treated. We may be dealing with a disease that has already passed. Now, I would like you to pay special attention to this diagram. You get infected with SARS-CoV, it goes into your respiratory system. But up to 5 days, 7 to 5 days before you develop your symptoms, you are actually multiplying the virus in your systems and you're actually spreading this virus, but you do not even know you're sick. This was a very important lesson for us to learn, and it will explain why the masks were such an important part of the tools we use to fight this disease. So the Kenya Catholic Doctors Association gave its first advisory on feeling unwell. You have your flus, you have your headaches, you have maybe a cough and that kind of thing. The virus is still multiplying rapidly in your system. Then it reaches a point your immune system is triggered, it starts pushing back and it fights back. And by the time you're getting to day 10, day 14, there is no more virus multiplying in your body. The immune system has destroyed the virus in your body. But then you now go into the phases that we call mild disease, severe disease, or critical illness. You get into that stage. Now, what determines whether you will go into mild, severe, or critical disease is the peak of the viral load that you experience in your body. And then because the amount of virus in your system is the one that produces the particles that your immune system reacts to. And this second phase of the disease, it is your own immune system fighting, your own body trying to fight a virus that has already been destroyed. So the inflammatory phase is the second phase of the disease. The other thing I'd like you to pay attention to in this slide is where shortness of breath occurs. So you have started your symptoms here, and your virus is multiplying, your body is already pushing back. So the first 1 week is when we have a window within which to destroy the virus. But then your difficulty in breathing starts when you have already deep into severe disease. So two things are very important here. If we were to beat this disease, then we must start your treatment as soon as you develop symptoms, so that instead of this curve going the way it is, we destroy it here and it collapses, and we only end up with very mild disease. If we miss this opportunity and you come after you have already, the first 1 week is gone, then you're already in the face of the critical illness. The virus is no longer the issue, and we have just lost our golden opportunity. The second thing is something that we call happy hypoxia. We'll talk a little more about this. But what happens is that in normal pneumonia, if you have a normal pneumonia, if you have a usual, sorry, not normal, there is no normal pneumonia. If you have pneumonia, say from a bacterial infection, and your oxygen levels decline to levels, say, below 90 or say about 93, you experience difficulty in breathing. You get air hunger so bad that you don't need anybody to beg you to go to hospital. You can tell something is wrong and you tend to report to hospital early enough for us to intervene. Unfortunately for COVID, people's oxygen levels are reducing to 60, even 40% before they have developed the shortness of breath. Now, what that means is that your body organs are operating at below the normal oxygen levels, and we already have your organs failing long before you have developed shortness of breath. And if you come in that state where your organs are already partially failed, there is no ICU that is going to save you. Again, very important about detecting early reduction in the oxygen carrying capacity of the blood. Now, a quick review of masks. Masks don't prevent you from getting infected. Please let us get this very clearly, dear Kenyans. Masks don't prevent you from getting infected. What the mask does, it reduces the dose of viruses that you receive, such that instead of getting severe disease, you get mild disease that hopefully would allow you to develop immunity. So when I wear my mask, the reason I'm wearing it is to keep my droplets to myself. That is what we had called our campaign, keep the droplets to yourself. So it is the droplets that I am breathing out as I speak, as I cough, as I laugh, as I sneeze, that carry the virus. And if those can be trapped in my mask, then it means that the viruses that may flow out of my mask to the person next to me will be fewer. And if the person next to me is wearing a mask, then most of the particles with the virus will be filtered out, and whatever will get to the person will be very mild. And that is how the masks helps us. So it doesn't stop infection. It reduces the dose of virus that we receive. It is actually the single most powerful item that we had for flattening the curve. And even in countries where, in Southeast Asia, countries where they could not manage to social distance because of the density of people, then just wearing a mask was sufficient for them to be able to contain and reduce the spread of the disease or the severity of the disease. Now, there is effective treatment against COVID. And again, this is something that is important for us to know. We have said this as Catholic Doctors Association, and we have experienced some pushback. But honestly, nobody needs to die from this disease because there is treatment that is available. Now, let us start with the basics before we go to the medicines. Anytime you have an infection in the chest caused by viral infections, then you have inflammation of the airways. And if you just took steam inhalations 2 or 3 times in a day, what you do is you reduce the inflammation in the chest, which eases off the discomfort and the damage to your lungs. But it also eases off the secretion so that it is easier to cough them out. So you take in steam. So it is steam, it is plain, it doesn't need to be put anything in it in the water. Cover yourself with a towel over this little pot of boiling water. It could be anything. It could even be just a little plate with steaming hot water. Take in deep breaths. Now we encourage you to take breaths through the mouth, in through the mouth, deep breaths in through the mouth, and then you breathe out through the nose. And you do that 10 times. What you're doing is that you're taking the hot steam into the respiratory system and dealing with the inflammation that is there. Then you repeat, but this time you take in 10 deep breaths, you take them in through the nose and you breathe out through the mouth. Now, what you're doing is that you're steaming the sinuses, and those are the open areas in the upper respiratory system, and that reduces the inflammation in those areas. It is also thought that the steam may reduce the amount of virus in those systems because the virus is susceptible to heat. But the most important thing here is reduce inflammation and ease the secretion. So anybody who has tested positive for, who has COVID symptoms or has tested positive for COVID should start steaming 2 or 3 times a day. The other thing is vitamin D supplementation. Now, vitamin D is critical in the well functioning of the immune system. And unfortunately, even in the tropics, we are seeing vitamin D deficiency. because, Pastor, as you can imagine, we go to work before the sun is up and we leave after the sun is down. And on Saturday, it is the day for hustling. And on Sunday, we're in church. There's very little time we are spending in the sun. So adults, especially the children, may be spending more time in the sun. And even when we go out in the sun, then we are wearing long sleeved shirts, we are wearing trousers, and you need the skin exposed to the sun so as to create your vitamin D. So if you're only using your face and maybe you're even wearing a cap over your head, then maybe it's just your hands that are exposed to the sunlight. We are beginning to see a lot of vitamin D deficiency. And vitamin D deficiency is a very poor predictor of outcome. If you have low vitamin D, this thing hits you and hits you very hard. So it's important that if you have been diagnosed to have COVID, you have symptoms, take your vitamin D. It is in many formulation. The one I like using is vitamin D3. Is 60,000 international units. You just take that weekly for 2 weeks, so just 2 doses. There is another one that is about 300,000 international units that you take once and it covers you for about 2 months. And there's a daily one that has about 5,000 international units. So I prefer the loading dose, take a large dose and repeat it in a week. Then we go to the specific treatment. And one of the most effective treatments we have is ivermectin. And ivermectin is a treatment, is a drug that has been around since 1970, has mainly been used to treat worms. So it is an antihelminthic. But most of those antihelminthics have been found to have antiviral properties. So in 2003, when the original SARS happened, a lot of them were tested and were found to be useful. And in June last year, our colleagues in Australia then tried ivermectin in the laboratory against SARS-CoV-2, and they found it was reducing the multiplication of that virus by up to 5,000 times. So it's very effective. That was in the lab. And now colleagues have used this as treatment. And we have a lot of papers that support its use for treatment. Now, ivermectin must not be taken by a pregnant woman or a mother who is breastfeeding. So we would prefer it to be used by everybody else except the mothers and those who are breastfeeding. The dose is about 12 milligrams per kilogram, 12 milligrams as a single dose. Is a dispersible tablet that you put in half a glass of water, you allow it to dissolve, and then you drink the solution. 12 milligrams, it depends on how many milligrams you find. Some of the tablets are 3 milligrams, some are 6 milligrams, some are 12 milligrams. So 12 milligrams, you take this once at the onset of your symptoms, and then you repeat it in about 5 to 7 days. And just those 2 tablets, those 2 doses, one at the beginning of symptoms and one at about day 5 or day 7 of your symptoms, we're able to stop the viral multiplication and prevent you from going from mild disease to severe disease. And we're able to keep very many people out of hospital, and many people are recovering very rapidly. Then there is an antibiotic that is called azithromycin, 500 milligrams once a day. It's taken for 3 days. It remains active in the body for up to 10 days. So some colleagues have used it for 7 days. We're using it for 3 days because we know it will still remain active for up to 10 days. It has been shown to have mild antiviral activity, but its main cover here is just to try and reduce the risk of what we call secondary bacterial infection. So this is the initial treatment, and it is very effective, and it is to be used by everybody else except the pregnant women and breastfeeding mothers. And we would prefer that this treatment becomes a treatment of choice for the majority of Kenyans, so that what can be used for the pregnant and breastfeeding mothers can then be spared for them. Now, the second line of treatment, of course, steaming still comes in, and the vitamin D is called the Zelenko protocol. Now, the Zelenko protocol was described by a gentleman in the US in March of last year. He's the one who told President Donald Trump about hydrochloroquine working for COVID. And it can be used by pregnant women and breastfeeding mothers. So although this protocol can be used by even non-pregnant adults who are men, we are trying to preserve it as much as possible for the pregnant and breastfeeding mothers, because some of these drugs are running out of the country. We are running out of supplies. Hydrochloroquine has been in use since 1955. It was used to treat malaria. Now it is being used to treat arthritis. You just take 200 milligrams twice a day for 7 days. Now, you must take hydrochloroquine together with zinc. Zinc comes in 20 milligram tablets or 25 milligram tablets. So you take 40 or 50 milligrams, depending on which one is available to you, just once a day for 7 days. This drug has been in use since the 1600s. And then, of course, there is the azithromycin we mentioned in the other protocol. So once a day for 3 days, I don't use the 7-day protocol. I just use it for 3 days. Now, what is important about this protocol is that the hydrochloroquine would not work on its own, and the zinc would not work on its own. These two must be taken together for you to have effective treatment. And it is the zinc that is stopping the multiplication of the virus. But zinc in solution is a positive ion and therefore is not able to enter the cells. So you need the hydrochloroquine to help the zinc transport into the cell so that the zinc can then stop the virus from multiplying. The gentleman called Zelenko who described this says, hydrochloroquine is a gun, zinc is your bullet. You need the gun to shoot the bullet. If I gave you a gun only, it won't work. If I gave you the bullets alone, they won't work. You need this combination for the treatment to be effective. So this must be given together for the treatment to be effective. Again, he was able to demonstrate that 85% of the people he put on this treatment did not require admission to hospital. It actually stopped admission to hospitals, and he was dealing with high-risk patients who were over the age of 65 and had underlying conditions. Now, when it comes to happy hypoxia, which we had described, it is very important that for anybody on treatment for COVID-19, or even if you decline to take treatment, it is very, very important that you monitor your oxygen levels at least twice a day. Now, to monitor the oxygen levels, you need a little gadget that is called a finger pulse oximeter. Today, I remembered to come with one. It's a very small gadget, and you open it and you put your finger in here. It has an on button, and once you click the on button, then basically it will read for you the oxygen levels. So mine is reading at about 95, 98. The figure below there then is the pulse rate. So the pulse will show down there. Is a very simple gadget. And if you monitor your oxygen saturation levels and you find that they're dropping below 90, you must go to hospital, because at this point in time, your organ has been damaged by lack of oxygen. And it also means that you need oxygen support. So at this point on oxygen support and the inpatient treatment for the disease then can be started. And every time a person gets to hospital early, the steroids and the blood thinners are coming in very handy, and more people are going home because they are going to hospital for treatment early enough. Now, depending on where you get it from, it would cost between 1,200 shillings up to 6,000 shillings. I ordered mine through Jumia. The first one I'd gotten it from a chemist, and they're now available in the country. If you have money to buy one, kindly buy two. Send one up country to the old folks, or to donate it to the nearest health center near you. It can be used by multiple people. It just needs 2 little batteries, and it can save lives. Okay. Now, if you monitor your oxygen levels for 14 days and they remain normal, then you're out of the woods. Your disease has healed, your immune system has activated, your medicine has worked, you cannot infect people anymore. You should be free to go back to work, go back into circulation. You remain masked just because we have to maintain that culture until we have defeated this monster. And you don't need to repeat your test. You don't need to repeat your test. It may remain positive for a while. The cough may persist for a little while. Some people are having a persistent dry cough for a little bit, maybe another 2 weeks, 3 weeks, a month, but it is more of a nuisance than anything to worry about. Now, survivors of COVID, if you have ever had COVID, then basically you have developed an element of immunity. And I've had a lot of colleagues say this is not true. Some people will say there is no immunity that you can develop after you get COVID-19. Ladies and gentlemen, the science, the beauty of science is very rational. Science is very logical. If you can develop a vaccine for a virus, it means that that virus has part of its capsule that is vaccine. Then it means even natural immunity would give us, even infection would give us immunity. So let's not have that discussion, but they would seem to be developing COVID twice. Most of them would have had a positive test, but no symptom at the beginning, and then develop symptoms and then get another positive test. And that has something to do with the tests, the kind of test that we are using. But you wouldn't be able to develop a vaccine for a disease where the viral capsule is not stable. That's why we don't have any vaccine for HIV, because HIV changes its whole capsule, and it is very difficult. It is very difficult for you to be able to make a vaccine. So long as somebody has gone and made a vaccine, then it means even natural immunity would give you, natural infection would give you immunity. So if you consider the costs of treatment that is averaging maybe 5,000, depending on which protocol you use, and you compare that to the cost of ICU care, and you imagine that if the government were to spend just a fraction of the money we are using to announce the deaths every day, and then intervene in the supply of these drugs and make them easily available in the country, the cost of this treatment would come down. And even where you're worried about the fact that 5,000 shillings is actually half the salary, a monthly salary of the average Kenyan, because majority of our people earn about 10,000 a month, it is still a much better amount to spend than you would spend. You cannot put a cost to life. Now, when it comes to prevention, and I'd like us to be very careful here. When it comes to prevention, the only people we are recommending that should be put on preventive care are people who are over the age of 60 and people who have underlying conditions. If you have diabetes, you have uncontrolled blood pressure, you have just finished your treatment for cancer, you have HIV, AIDS, those people are the ones we must allow to take preventive care, because if every Kenyan went and took preventive care, then of course the drugs would run out and we'd have more people dying. Now, for the elderly who are 60 and above, and if you have any underlying disease, then 12 milligrams of ivermectin taken weekly for 4 weeks is sufficient to protect you from this illness. There was a study that was done in Argentina, and they had 800 healthcare workers who were put on ivermectin at 12 milligrams weekly. And then they had about 400 workers who did not participate in the study. And at the end of the study, all the 800 workers who were taking 12 milligrams weekly did not develop COVID, while 58% of those who did not take the treatment actually developed COVID. For the younger people and the people who don't have underlying illness, kindly don't bother taking any preventive care. For you, treatment would be sufficient. And remember, only 10% of those who get infected are developing symptoms. 90% are healing without even knowing that they got the disease. Vitamin D supplementation needs to be given to these old folk at 60 international units a week. And this 4-week treatment protocol can be done with an interval of 2 months. So you take 4 weeks, take a break for 2 months, and then take another 4 weeks. But our hope is that if we could get this message out there, in 2 months or so, we should not be discussing COVID anymore in this country. Now, hydrochloroquine and zinc can be used as preventive care, but again, we are trying to save these treatments for the pregnant women, so I will not go into that. What does it mean to have effective treatment? We can return back to normal. Our estimate would be that by June, July, if we could get people to support us to do this campaign and say that treatment is available, by June, July, we should have defeated COVID. Those who are pushing for vaccines are telling us the last person in Kenya would be vaccinated in 2023. We cannot wear masks for another 2-3 years. You know, it's horrible to even think about it. So if we inform the public that there is effective treatment, but it must be started early, report to hospital as soon as you develop symptoms. Then we educate the public on the value of using the pulse oximeters to determine who would need admission to hospital. Then we make the drugs available, easily available, and we make sure that doctors in the hospitals are prescribing them. People can be able to buy them over the counter. These are safe drugs. You can buy them over the counter if you have no access to a doctor. And then we measure our success by not by the number of infections, because the infections may continue going up, but by the reduction of what we call the case fatality. How many people of the group that tested positive died? If we have fewer and fewer deaths and fewer and fewer total deaths, then you'll be able to see that there'll be a big difference. If you have been paying attention to the statistics, you would notice that now part of the death count is coming from records. Okay, so we are beginning to see the reduction in deaths, and they have to go back to records to pick up those that they may have slipped through. But the idea is we want this to be zero. One death is too many deaths. These are our brothers, these are our sisters, these are our mothers, we don't want to lose any more Kenyans. Now, I wasn't asked to speak about vaccines, but there's some things I need to say here. There has been a story going out around that people who reject vaccination are threatening those who are vaccinated. Now, there is no scientific sense in that statement. And I repeat, the person who is unvaccinated can never threaten the person who is vaccinated unless we don't understand the science. If a vaccine is effective and you have received that vaccine, then ideally you are protected against the disease. You shouldn't get sick from that disease, or if you do, you should get mild disease. If I refuse to be vaccinated, it is me who is at risk, not you. Let us stop this reverse psychology of intimidating people who don't want to take the vaccine. If you have been vaccinated and I haven't been vaccinated, you shouldn't be bothered by me, because I am the one who has taken a risk. Ideally, you are protected. So unless your vaccine doesn't work, then that story doesn't hold water. I'll repeat it as many times as is necessary until we get it clear. Now, any person who is getting natural infection of COVID-19 or whatever other virus that has a vaccine develops superior immunity to that person who was vaccinated. Again, I repeat, if you have gotten natural infection against any viral disease, you develop superior immunity than a person who has been vaccinated. Again, this is science. Remember that the person who is being vaccinated, it is the scientist who decided what part of the virus they will use to generate immunity. So they have taken a small part of the virus, they have put it in this genetically modified virus. So you develop antibodies against the spike proteins. The person who has gotten the complete virus through infection, On the other hand, it is the immune system that determines how many types of antibodies to produce against this virus. So they may produce viruses against the spike proteins and many other proteins that are found in that virus. So generally speaking, if you get natural measles infection as a child and somebody else is vaccinated, it is possible that the vaccinated person may get infection later on in life because the person who got natural infection will have immunity for life. This is just basic science. We don't need to debate it. Now, the other reason why that happens is because natural infection follows the natural pattern of disease. So if COVID-19 is coming through the airways, the respiratory system, it goes through the epithelium of the respiratory system. What you develop first is called cellular immunity, and then later on you develop humoral immunity. And cellular immunity is the one that is very important in viral infections. But when you are injected, when that infective material that is being used to stimulate your immunity is injected beyond the skin surface, then what you tend to develop more is humoral immunity as opposed to cellular immunity. And what that does is that the immunity is only effective once the virus goes into any place where there is the blood system is active. And that's why we are being told, those who are vaccinated, you're being told you can still catch COVID-19, you can still spread it. And the only thing they hope to do is to reduce severe disease or death, which we can effectively do with the effective treatment without threatening those who are not unwell. Mandatory vaccination only makes sense in an endemic situation. So you first get an epidemic, then after that, if you find the disease is staying in the community, then you develop a vaccine against it. But if you find the disease has disappeared and gone like the Spanish flu, there is no need of wasting money, spending money to create vaccines. And finally, remember that your vaccination history is a very private matter between you and your doctor. The day we allow ourselves to be required to have a vaccine passport, to be required to carry a passport that indicates my health status so that I can get services or be allowed to travel or be allowed to access services, we have just allowed ourselves to be enslaved. Up to today, ladies and gentlemen, if I am looking after a woman who is HIV positive and she doesn't want me to tell the husband, the law is such that I cannot disclose this matter to the husband without breaking protocols, without actually being liable to being sued. And this was done so that we do not stigmatize HIV and those who have HIV infection. You all know that you cannot be denied employment based on your HIV status. What is this that has changed? All of a sudden now we must carry passports that say you have been vaccinated against certain diseases and that you have been tested against certain diseases. This thing, if left on its own, COVID-19 would probably have died down. A natural death like the Spanish flu did, like SARS did in 2003. But because it is necessary to bring in a kind of control mechanism, this seems to be the end game. Otherwise, nothing of what WHO is doing makes sense. Thank you very much.
Thank you so much, Doc. At some point I was going to tell you we're running out of time, but it was so fascinating. I just could not stop listening. And I think, I suspect for many, I suspect for many people here, they're grateful that I let you finish. So thank you so much. And I know that we could have actually gone longer if you had more time. I just suspect I could tell you are really also trying to compress your presentation. Now, I think as we have had the conversation, for those of you who were there on Monday, then you probably then understand when Doctor says what he's saying is controversial in some circles. And I guess part of what we are doing in exposing you to this conversation is because I'm of the school of thought that the best way for people to make informed decisions is for them to understand all sides of an issue. And I don't think the issue is for us as a church to tell you what to do, but I think it's to allow you to hear different opinions and differing thoughts so that you're able to make an opinion. So some of you have asked questions about the what do you call it, the antivirus and what we're trying to say is the vaccine rather. And what we're trying to say is with the vaccine, if you have specific questions, which one to take, does a second dose work as well? We answered a lot of those questions on Monday. So I'm going to ask that we don't actually spend time on that. And even with our time, probably I'm going to just allow, usually we had said we want to end by 7:30. And Doc, with just your permission, we'll just take a couple of questions just because I think it would be just fair to do that. For those of you who are here, please allow us to just do that just because I think what we learned today or what we had was very interesting. Let me just say, watch both videos. Then you'll be able to make your informed decisions for your family, because this whole idea is in protecting ourselves and our families. So Doc, I just wanted to say, number one, I want to ask, are you saying don't take the vaccine? I think it's important for you to say what you're saying. Are you saying don't take the vaccine? And then another question that was asked by somebody is immunity and mutation. So you say, once I get COVID, then I've got immunity. But as I understand, this is not like HIV. This is a virus that seems to be mutating. I don't know how true that is, but this is what at least I've understood from my layman's perspective. So if I got it the first time, like a flu, you get a flu, but you don't get lifelong immunity. So maybe you could comment about that. Just clarify on those two statements.
Okay. So the first one was on.
Are you saying don't take the vaccine? I think that was
yes.
asked.
The thing is, if you ask for my professional opinion, then what I would tell you is that the vaccine is unnecessary. All right. Whether you will take it or not is your business. But where you have treatment available for a disease, then the option that is best to take is a treatment. Understand the disease, take your treatment early, and make sure you report to hospital if complications arise. Now, why is that the better option where there is treatment available? Because when you offer treatment as what is your principle, then you're saying you'll only deal with the 10% of people who are sick. You're only dealing with the 10% who get sick. When you do a vaccination, then you are going to vaccinate the 90% who are well in order to protect the 10% who could get sick. And if you think about it, if you have just, say, 1% of complications in a vaccine, just 1%, and we have 53 million Kenyans, then you're saying you're going to injure 530,000 Kenyans. And in 1 year of this COVID disease, we have lost 2,000 lives. When you consider that risk factor, it doesn't make sense. Okay, so where you have treatment is, for instance, if I made a vaccine for tonsils, would you take it? Wouldn't you rather go and take an antibiotics for 7 days and that story is over? So vaccines are given to the healthy population. You never take that risk unless there is a major reason, good reason to do that.
Yeah.
So the second one is about the mutations. Now, what happens is that every time you get this virus, the virus itself wants to survive. So initially, it is very aggressive, and the people who get sick, many of them die off. If the person who is infected dies, then that virus cannot spread. Okay, so what happens is that naturally, the strains that are more infective but less lethal tend to be the ones that survive. Okay. So the mutation you generally will get naturally would be that the disease spreads quicker, but is causing less deaths. So you kind of, it tempers down because the virus wants to also survive. But the idea would be that the people who had SARS in 2003 were found to have cross immunity with SARS-CoV-2, which is causing COVID-19. And this was 18 years later. all right? So you check their blood, they have no antibodies against SARS, but their cellular immunity is still active and protecting them against SARS-CoV-2. So these are the same viruses, they are coronaviruses. And that's why once you have the coronavirus and the spike proteins are stable, that the virus may mutate other things other than the spike protein, that gives you an opportunity to develop a vaccine. And it is the same principle that then means that anybody who gets a natural infection can develop immunity. So,
Okay.
yeah.
All right. Somebody else asked about, or somebody said vaccines may not have been used in the past, but maybe that shouldn't be an argument for why they can't be used. Maybe is this just the next step of fighting diseases where prevention becomes better than cure? So using the vaccine as prevention.
We have vaccine experts who are warning against the use of vaccines during the height of the epidemic. Because what happens is if you get vaccinated and you tend to, the virus that is developing in you tends to mutate in a special way that it tries to resist or to avoid the immunity you have developed from the vaccine. There is a risk that you may end up with a more pathogenic strain. Okay, so that's the science. I'm not an epidemiologist, but there is an epidemiologist who is trying to ask WHO to stop these vaccinations during an outbreak. The best thing is to allow us to manage the disease if it remains in the population after this. And there is a stable thing like HIV was with us. It was a very serious thing. Now we've managed to control it, but it's still with us. If we could get a vaccine for HIV, then people would get it. So it's in that kind of sense that during the outbreak, it is not the right time to be vaccinating.
Thank you. Somebody asked how long after immunity, or how long do you have immunity after getting COVID-19? And I think this is a question that was asked with last week, but it would be great to have your perspective as well on that.
If you look at what we call humoral immunity, the one where you develop antibodies, is very short-lived. So you start developing your antibodies maybe within 10, they peak maybe 2 months, 3 months, and then by the end of the 3rd month to the 6th month, basically you have no antibodies. But you must understand that the immunity that is effective and remains for a longer time is called cellular immunity. It's not easy to test for cellular immunity. But what we can say, for instance, is if immunity was not developing, if you can get COVID 2-3 times, then the numbers would never come down. They would keep going up and up and up until the whole human race is eradicated. That's how you must understand it. The fact that the numbers come down, once you hold everything stable, the infection stops and the number starts coming down. The only way you can explain that scientifically is that there is an element of immunity that is developing. Now, how long that will take, we've only had COVID from December 2018. So we know maybe 1 year, maybe. We don't know the rest. We don't know what will happen in another 2 years, whether it will all be gone. But like I said, some of the people who were tested who had developed SARS in 2003 had still active cellular immunity that also was preventing this current infection.
Yeah. So you're saying basically, but there have been those cases of people getting reinfected. At least that's what I've read.
You see, in science, you cannot never say never. We never say never. Even if there was people who are actually, even if there are people who are getting reinfected, the rate cannot be the same. Otherwise, the curve would never come down. So there may be 1 or 2 cases, or there may be a person who had a positive COVID test that they got when they were doing a test without infection, because work had insisted the test was positive, and then you now have symptoms and you repeat the test and it is positive, then there is a possibility that the first test was a false positive. Okay,
but
so there could be.
What if you're symptomatic both times?
You are symptomatic both times, and that would be something that would be interesting to see. But the PCR test, the sensitivity can cross-react, okay? So remember, the coronaviruses are many. Even the common cold is a coronavirus. So there is an element of false positivity that would also be there, and one would really need to investigate this further. The truth is that it is not common. None of the patients I have treated since May last year have developed the disease again. None of the relatives that I have put on treatment have developed the disease again. The staff in my office who developed the disease, none has gotten it again. So the colleagues in hospitals where we work and dealing with COVID every day, none has gotten COVID twice. So they would be, the way I would look at it is I would not say never, but I would say that if it is happening, it cannot be as common as those who are not getting it twice.
Got you. Okay.
Mm,
Well,
yeah.
somebody asked, well, I'll ask one last one. Vitamin C, you didn't mention that at all. Is that important? People, you talked about D.
The vitamin C has been used for donkey as for people who have colds and flus. I did not mention it because we also have to guard against a very expensive prescription, very long prescription. And in the studies that I have looked at, it's not been used. And I'd like my patients to have just the least amount of drug necessary to get better.
Okay.
It wouldn't hurt you though.
Yeah.
Mm.
Now, I want to, I sense there'll be a lot of questions, and we could actually be here the whole night, Doc, talking. But I do want to say, guys, I think what we've heard these 2 days that we've had this family conversation is extremely important to pay attention to. And one of the things I really believe is it's good to be forearmed. And this is from personal experience. When you catch somebody in your family with COVID and you've not had time to reflect, then the worst thing that happens is a spirit of fear comes upon you. And it's very easy just to panic at that time, because you really try to think all the things you've read on WhatsApp groups, all the things that people have been talking about, and everything. I mean, I can tell you, it all goes out of your mind. And so one of the things we wanted to do by having this conversation is to actually be able to have a record where you can actually share with a family member. You can actually say, hey, here's something. Now, I will say this. I mean, I respect greatly both doctors who've come on, and I think I called them because I knew they would have differing opinions. It was actually very intentional to do that. They're both people who love God, and they're both very intelligent, thinking professionals. And I feel like that's part of what we must allow is dialogue, conversation, because you learn something from either side, and then you're able to make your decision wisely and well. I think what Dr. Wangai said is he said, hey, you know what, vaccine at every cost, all of you should get it. This is what it's going to take to handle this crisis. And I think that's a great, that was his perspective. What Dr. Wahome is saying, what Dr. Ngare is saying is actually COVID is treatable, and there are ways to treat it without necessarily, he didn't say you shouldn't get vaccinated, but he said there are ways to treat it so you don't need to go that way. And that's like I will say, Doc, that is not conventional opinion. If you try and even do a Google search of that, you'll find that that opinion has been hammered. And I would love to maybe engage in another forum just to ask, why is that? Why is there such opposition to what you're saying? And maybe just for today, maybe that won't be in the scope. But I think one of the things I do think, and personally, maybe just to give my opinion, is that I have, like I said, we've had COVID, several members of my family, and we have used some of that regime that Dr. Wahome prescribed today. And we found some remarkable turnaround. And I've actually shared it with several of my friends as well. In fact, that's one of the ways that I got to know Dr. Wahome is I shared it with one of my friends who was really ailing. And he as he was practicing it, he watched the video and he said, that guy, I know him, he's a good friend. In fact, we're related. And so he called him, and later on, when he was recovered, because he had a total recovery, he called me and said, by the way, you really connected me with my relative. And that's how I even got to know him, because I kept referring this doctor I thought I'd never meet. And so it's just to say, I think there is something in this that you need to listen to, pay attention. And I actually agree. I was troubled for a long time when I saw people being sent home to take Panadol and to wait for the condition to get worse, because inevitably it was getting worse in the people I was watching. And I kept thinking there must be a way to do something a little different. So I want you to be very careful. I'm not saying don't vaccinate, but I'm saying don't be helpless either. I think knowledge is power. And when you begin to understand, when we get this condition, when somebody in my family begins to get some symptoms, immediately, I don't have to wait for things to deteriorate. I can actually begin to take some action. And I think what Doc is saying is if you do that, you could save lives. And I think that's what we're about right now. So, hey, please share the information with your Doc. I'm going to give you an opportunity to give a parting shot, a very brief one. Let me just say, share this information, share the other video as well. Let's get people watching. Let's get people conversing. Let's reach a place where our families are making informed decisions, because I think we must learn to think for ourselves, not just to read what we're told in the newspapers and then just apply it blindly. So Doc, if you would just say, maybe just a final parting shot, you're a man of faith, you're speaking to a faith community. I don't know what you'd want to leave us with. And then we're going to conclude and just release everybody.
Yeah, thank you very much. Part of our business is to save life, and we will need to save life, both physical and spiritual, so that as we live here, we live a healthy life, and we have hope for eternity. It is very wrong for us to watch people dying from a disease that is treatable, and it breaks my heart. I wish I could just get the opportunity to convince the government or the church to take this campaign seriously. Let us give people ivermectin, protect the old ones with the ivermectin. Let us put everybody on treatment, anybody who has symptoms, whether you're positive for this test or not. And let us make sure everybody who is sick monitors their oxygen level. And June, July, this thing will be done. And it will be very nice because WHO is collecting data. You cannot lie on those data. If we manage to bring down death rates, it will be obvious. If the infection rates go down, it will be obvious. I wish we could just find a way of doing this campaign. We don't have the capacity the government has. But if only we could take this, I mean, what do you have to lose? You're marketing a vaccine on one side. Why don't you market treatment on the other side? All of us are aiming towards saving life. Let's stop deaths.
Thank you, Doc. And I will say, I mean, even the people watching, not everybody's happy with what you've said, Doc. I'll say that to you.
I am not surprised.
One of the comments is that your stance is anti-vax. That's somebody said that.
It's a good comment that every time you hear the word anti-vaxxer or you hear the word conspiracy theorists, then you're dealing with somebody who has reached the end of thinking capacity. They have refused to think. They are safer stopping to think and labeling you so that you can shut up. I support vaccines, I give vaccines, but not every vaccine is useful. Let's just get that right. You don't give people vaccines because somebody has produced a vaccine. That is commercializing medicine. You give vaccines because they are necessary. So there are vaccines that are very useful that we give, that I recommend, and there are the vaccines that I call unnecessary, that are commercial or have other interests that I will oppose, and I will do it unapologetically.
Thank you, Doc. And I think why I even mentioned that is to say, we've had some of you are listening on Monday, you really supported the vaccine stance. And I think there was a respectful conversation. Today, we've had somebody who says, maybe not as strong, I don't quite support that perspective. And my own opinion is we must not label each other. I think when we start to do that, then again, like Doc says, we stop to think. We must engage intellectually. And so thank you, Doc, for that. I support what you've just said. And so, hey, let's have this conversation. How would somebody find you? If they want to find you, if they want to ask you more questions, if they want to see you in the clinic, is there an easy way to find you?
My clinic is in the Cardinal Otunga Plaza Annex. That is in the same compound as the Holy Family Basilica. It's called Mercy Medical Center. And maybe I could post my email address.
Yes, please. Yes, please. Just type it out there. Somebody might want to see you after this. So thank you so much, Doc. We really appreciate your time. Let me just say that we will have more family nights. Next Wednesday, 7:30, we're going to have a family conversation. What we're going to be doing next Wednesday is very interesting because we're not going to be hearing from a doctor. We're going to be hearing from members, friends, family members, people who have actually survived. Maybe we should call it the thrivers, because survivors sounds like they're really, I mean, they're through it, they've come out of it, and they have stories to share. And so we want to do 2 or 3 and just hear their story, hear their perspective, what helped them, what kept them positive. I think one of the things that you've heard with this illness is part of what's happening for people is the what do I call it? The panic, the fear is actually a major thing. And so what we believe is as they share their story, they're able to help you begin to understand, okay, this was their experience. This is what helped them in that situation. And this is what to look for if you ever get into a situation like that. But my hope is also that there will be a message of hope that will come out of that, because I know some of them are really spreading hope now to their friends. So we're going to have this conversation. Remember, the idea of family night is just so we can create a place where we learn how to care for our families in this season. And so it's not all going to be about vaccines and about coronaviruses. It's also going to be about how do we create healthy relationships for our family? How do we take advantage of the opportunity this crisis gives us to have conversations with our families that we never would have before? I believe that God has actually given us an incredible opportunity to deepen the relationships in our families in this season and to go much deeper, to actually see things happen. Some of us, by the way, there are historic things that have happened in our families that I believe God is going to break in this season. I believe that God is going to actually change trajectory of families because God opened a window for conversation that wasn't there before. And I am actually looking forward to seeing what our family nights allowed to happen in our community. So, hey, let me just encourage you to be in prayer for this initiative. All the Mavuno campuses are working along with this. If you're a friend of Mavuno as well, you're welcome to join us for family nights. This is a time for us to just be part of the family. And what we're hoping is not next week, but the week after that, we're going to actually start opening them up. So we have a conversation and then we have life groups meeting. And so if you're not part of a campus, a Mavuno campus, want to just encourage you, join that. Please connect with the WhatsApp community. You saw the link that's on the screen right now. And in doing that, you're able to actually, we'd love to connect every single one, come out of COVID stronger. Many businesses have struggled alone. We can work together as a family. We can work together as a community. We can emerge from this thing stronger, supportive of one another, and actually doing what God created us, taking advantage of the crisis. And I think one of the things I want to just say is, if there was no Goliath, there would have been no David. And for some of you, this is the Goliath that is going to bring out the David in you, the person that God created you to be. And that's our prayer as a community. So I'm going to just speak a prayer and a blessing over us and over every family that is here. I know there's some families right now that, my goodness, you're mourning. And I know that because I know some of you personally, you've had a death this year even from COVID. Some of you, it's illness. There are members right now in ICU or people at home who are struggling with illness. There's fear because of that. Some of you, it's economic. And so I'm just going to ask you, wherever you are, just raise your faith with me and let's just pray together as a community. Father, I just want to thank you for this evening. Thank you that, Lord, we can come together as a family and learn together. Thank you because, Lord, in the middle of a crisis, there's always an opportunity. There's an opportunity for God to be glorified. There's an opportunity for our faith to increase. There's an opportunity for us to grow in our thinking, in our engaging in the situations around us. There's an opportunity, Lord, for every one of us to support each other, to be who God has called us to be. And so, Lord, we just thank you for this evening. Thank you for Dr. Wahome Ngare and his insights. Thank you for his experience. Thank you for his boldness to speak in a way that is not necessarily conventional and share his convictions, because I believe he shares them as a man of faith. And Lord, I just pray that you would bless him, bless his family, bless his practice. Lord, I pray that you would, you who is the first physician, that, Lord, you would help him to represent you in everything he does. And I pray that, Lord, he would bless many. I pray that, Lord, he would he would have many testimonies of you using him to bring healing and hope to many families and to many people. I pray, Lord, for everybody who's here, who's going through a difficult time. Father, we just come to join our faith on their behalf right now. I pray, Lord, that you would comfort those who are mourning. I just pray that, Lord, in this season, they would see the Lord. I pray for those who are sick and or who have members who are sick that they're looking after, and maybe there's been a spirit of hopelessness in their situation. I pray, Lord, life right now. I pray encouragement. I pray that the joy of the Lord will be their strength. I pray that they would walk out of this, even this conversation, with a hope, with a new light, with a new sense of purpose. Lord, even if their questions were not yet answered, I pray that, Lord, they would still walk out of here with a sense of hope, knowing that God is with them in their situation. And Lord, I pray for every one of us that, Lord, you would just give us a great ending to this week, in our offices, in our homes, in everything we do. Lord, walk with us, and we will walk with you as well. And so I bless you, God's people. I bless you, God's family, in the name of the Father, and of the Son, and of the Holy Spirit. And God's people say it together, amen. God bless you, everybody.
Thank you.
Watch the 2 videos again, share them, and let's just keep the conversation going. God bless. Thank you again, Doc, and God bless you. I look forward to connecting some more.